Here we go again. This is Pharmacist Keith. Just wanted to do a quick blog post as a response to a news report that I heard tonight. I just heard a report on ABC from Diane Sawyer that a study recently came out that women with cardiovascular risk factors should be placed on statin drugs. They claim that women in their study had a reduction in cardiovascular events of 19%, and their conclusion was that every woman with cardiovascular risk factors should be placed on their statin drugs. Now, they fail to mention, however, that according to Harvard researchers who reported that women in the university's Nurses' Health Study, that's a study of over 80,000 nurses, that those who used aspirin regularly had a 39% lower risk of heart attacks, and even a 12% lower risk of getting cancer. Okay, now let me ask you this. Which would you rather take? A statin drug that's dangerous and filled with bad side effects for a 19% reduction in cardiovascular events, or an aspirin a day, which doesn't have the large side effect profile of statin drugs and reduces the risk of cardiovascular event by as much as 39%? Now, the statin class of drugs has been the biggest moneymaker in history for the pharmaceutical industry. The dream of every pharmaceutical company CEO is to develop a drug that people will need to take for the rest of their life in order to control their condition. The statin drugs have been the answer to their dreams. But the public has been denied one essential bit of information, as I mentioned above. The benefits of statins, cholesterol-lowering drugs, are no better than taking an aspirin a day. In fact, according to the pharmaceutical industry's own studies, the improvements in reducing heart attack and stroke risk are virtually the same as following an aspirin regimen. The latest studies show that inflammation is an independent risk factor for heart disease that's much stronger than any measure of cholesterol. I cite a study of two statin drugs, atorvastatin and pravastatin. Now, this study was reported in 2005 in the New England Journal of Medicine. The study found that patients with low hsCRP levels, that's a level that a test that measures inflammation, that patients with a low hsCRP levels had fewer heart attacks, no matter what their LDL cholesterol level was. And they had more heart attacks if their hsCRP level was elevated. That is, if their inflammation levels were elevated, regardless of the LDL cholesterol level. Now, the same thing has been found for stroke risk. Another recent study, the pravastatin and atorvastatin evaluation in infection therapy, thrombolysis and myocardial inflammation. The study again was the pravastatin, atorvastatin evaluation and infection therapy, thrombolysis and myocardial infarction 22. They call it the Prove It TIMI 22 study. It examined patients on high and moderate doses of statin drugs. Now, the study found that in both groups, there was no difference in the cholesterol levels of the people with cardiovascular events, that is strokes. There was no difference in their cholesterol levels. And those without. Okay, let me repeat that again. The study found that in both groups, there was no difference in the cholesterol levels of those with a stroke and those without the strokes. The only difference was in their levels of hsCRP. The only difference was how much inflammation they had. Now, few physicians who prescribe statin drugs know that the link between elevated cholesterol levels and strokes has never been established, but the link to inflammation is strong, and it's supported by many laboratory and clinical studies. Reported reductions in stroke risk for people taking statins have varied from no statistical reductions whatsoever, as in the TNT study, to a 19 to 50% reduction, as in the lipid study, the CARE study, and the Miracle studies. Now, newer evidence, however, suggests that any reduction in the stroke risk from these studies is secondary to the anti-inflammatory effect of the drug itself. That is, these statin drugs reduce inflammation. It had nothing to do with the amount of cholesterol levels that these drugs lowered. Now, why is there so much deception? Why don't the drug manufacturers and physicians who promote the statin drugs just change their policy and give statin drugs only to people with increased inflammation? Well, it comes down to dollars. If they make lowering cholesterol their goal, especially a drastic decrease in their cholesterol, they can convince doctors that everyone, even children, should take them for a lifetime. Yet if they use HSCRP or some other measure of inflammation as their criteria for prescribing a statin drug, the drug wouldn't be given to 75 to 80% of the people presently prescribed to them. Because, frankly, aspirin or other less dangerous anti-inflammatory drugs would be used instead. That's a massive loss of revenue. You know, folks, it's stories like these that really frustrate me. I got into the healthcare business to help people get healthier so they can have a better quality of life. That's just not happening. It's really frustrating to see more and more of my patients get sicker. It's frustrating to see their health and their quality of life get worse over the years, and it's really sad to see all the money that they're spending on this poor excuse for healthcare. Now, I encourage you all to go to my website, therx4health.com. That's THERX, the number 4, health, HEALTH.com. There's a video that I've posted there from Dr. Wallach entitled, it's actually his lecture, Dead Doctors Don't Lie. I want you to visit that website, listen to his message. It takes about an hour, but it's a very thorough message on what you can do to improve your life and reduce the chance of having the inflammation and all these other types of diseases and health conditions that, quite frankly, we're spending a fortune on in medicine, and it's just not helping. I encourage you to watch the message and then to contact me so I can show you the 90 for Life program and how we can drastically change your life and change your health. I encourage you to give Doc Wallach and myself 90 days, and I'll guarantee you'll feel better. The website again is the RX4Health. That's THERX, the number 4, HEALTH.com. After you visit the website, watch the video, be sure to contact me. I'll help you out.